My name's Nick, and I am a certified nurse practitioner here at Radiant Divine Medical Spa, and today we are talking about hormone replacement therapy, or HRT. So hormone replacement therapy is something that's going to be very subjective to each person. No one patient's hormones is going to be the same. And because of that, lab values are imperative. So a big part of our consultation process is really understanding your symptoms. Hormone replacement therapy, although can be dosed based off of lab values, we also take into consideration the symptoms that you're feeling at that time. So, our dose is really going to be dependent on two things. First is going to be your lab values and your objective results. And second is just going to be your subjective data telling us how you're feeling and what you're experiencing day to day. So there is an ideal patient demographic that comes with hormone replacement therapy. We're typically looking at women, in the peri or postmenopausal years. In men, it's typically in their middle age, let's say 40 to 50 years old, when they really start to feel that testosterone drop. So we'll use your lab values and then along with your subjective data that you give us to determine if you are the right candidate for the treatment. If your lab values do come back within optimal ranges and there's something else going on, Radiant Divine's more than able to point you in the right direction. If you have any further questions regarding hormone replacement therapy or HRT, you can visit our website or you can give us a call here at Radiant Divine to schedule your free consultation with us.